after faxing 40 pages of records to them, we got to spend 40 minutes filling out 7 more pages of paperwork, including multiple insurance forms. I can buy a car by swiping my card through a card reader. I can actually buy a house by doing that. But to get this visit, it took 45 minutes of redundant paperwork.
When you get a plan, you have to keep it. What is it, 3/4 of the year or something? No matter what's going on. I had another plan that didn't pay my bills for 8 months. But you're not supposed to be able to get another plan.
I was kicked out of the medical system when I was 18, and I was no longer eligible for service because my mother had a higher paying job, and because even though I was unemployed, I still couldn't qualify because I was dependent.
I get my care from the Palo Alto VA. I've been to the Fresno VA. I cannot tell you how pleased I am with the care I get. I get appointments when I need them. I get tests when I need them. I get told when I need to take a test, and I go take it.
But they're acting like they can do anything they want to do to us. And I'm not the kind of person that'll let that happen.
I was divorced in 2005, and because of that, of course, my husband lost his insurance because it was on my policy. He hasn't had insurance since. I've been trying to help him get insurance since January, which just goes to show you, once a dumb bunny, always a dumb bunny. But since January, he has not been able to get insurance. And if you've ever tried to get it lately, if you need it, you won't.
I lost my insurance when I had a heart attack and quad bypass last year. It's been about 1 year ago now. And my extreme fear, given that I'm in California, is I'm currently receiving medically indigent service program care, which is medically, I'm broke.
Lee inspired me to speak because it just breaks my heart to see what happens to people like Lee who have good jobs and have health coverage, and then something catastrophic happens to them and their life changes. And I'm one of the fortunate people who has really excellent health care through my employer, and I can afford to pay my premiums. But my life is not any more valuable than Lee's.
I have to say that I have a great doctor there, and the county is taking care of things. But it's a very scary situation to be in when it's month to month, and you're dependent on public assistance.
I want them to knock that much out.
I would like to see, in the long run, getting back to what we talked about before, the VA, at least the VA I deal with in Palo Alto, is a model of how efficient and effective health care can be presented to the man on the street.
Preventing the insurance companies from shifting risk away from them onto every other entity, because that's the game they play that needs to be addressed.
I would like to see universal coverage so that everyone is eligible for coverage and gets it.
It's hard for people my age to maneuver around the system because we don't know very much about it, and I'd like to see it more friendly for people who are my age.
It should not be lost that the overhead for operating the VA is 5% of their operating costs. The overhead for operating an insurance program is 20 to 25%. Going from insurance to the VA will save everybody a fortune.
Really universal health care, because I know now a lot of people who are in this situation that I've met, and the lines down there at the pharmacy are just unbelievable. It's 3-4 hour waits minimum.
My comfort and my health is not any more important than Lee's, and our country needs to start recognizing health care as a civil right that everyone's entitled to equally.